I'll be discussing pain in the sacroiliac or SI region. This is a common area of pain which can affect one's ability to enjoy their life. I'll be discussing common causes of pain and dysfunction in this region. The sacroiliac joint is a part of your body that connects your spine to your pelvis and your legs. Pain in this region generally causes pain near the tailbone, into the hips, or it actually can wrap around to the front of the thigh. The symptoms of SI pain can mimic that of low back pain. The main indicator that you may have a sacroiliac problem versus a low back problem is the location of your pain. Low back pain is generally going to be above the level of the tailbone, where SI problems are typically below. Patients with SI pain rarely have pain any higher than this region. Sacroiliac pain is a very common form of lower back pain. We especially see these conditions in patients who are in younger to middle-aged demographic. There are three main causes for sacroiliac pain: traumatic, biomechanical, and hormonal. I will discuss all three causes briefly in this Pain 101 course. The first problem is traumatic injuries. This type of condition usually results from a jolt to the sacroiliac joint. There are ligaments that connect your sacrum to your pelvis. They can be injured by direct trauma, like falling down on your buttocks, or from an indirect jarring force. For example, if you've ever stepped off a curb but didn't see it coming. That jolt can often cause a sprain of the ligaments and structures surrounding the SI joint. When the ligaments in the SI joint are injured, they can get inflamed and extremely sore, causing pain with daily activities. The second factor can be biomechanical problems. This is probably the most common reason for SI joint pain. Things like muscle imbalances, leg length differences, and pelvic muscle weakness can create misalignment within the pelvis. These dysfunctions will often create a problem with too much motion, hypermobility, or not enough motion, hypomobility. The SI joint is the link between the legs and the spine. If you develop tightness on one side of the pelvis due to an injury or other factors, it will create an uneven pull where you become tight and strong on one side and loose and weak on the other. This can often lead to some rotation in the pelvis where one side is pulling more than the other. If the pelvis gets uneven pulling, it can cause the pelvis to rotate. This will put pressure on the ligaments that connect the pelvis to the sacrum and can cause some pain. These symptoms can often limit how much we can stand, walk, or tolerate daily tasks. The last cause I will discuss is hormonal. This cause of SI joint pain we typically see at the end of pregnancy or just after delivery. There's a hormone that is released by the body as it prepares for the final stages of pregnancy. This hormone makes the ligaments more flexible and allows the pelvis to open up to make delivery easier. Unfortunately, this hypermobility can also cause the pelvis to rotate and increase tension on the ligaments. Back and sacroiliac pain due to pregnancy is very common. Very few women can make it through their pregnancy and avoid pain in this region. If you are experiencing pain in your sacroiliac region, there is much you can do to decrease your pain. Initially, you should rest this area to prevent further strain or injury. If you are having pain in this region and it is strained, it is important to not stress this area by excessive activity. Ice can then be applied to the affected area. This is a great modality to help decrease pain and inflammation. In addition, there are specific exercises that you can perform to help improve the mobility in this region, loosen your musculature, improve your strength, decrease the pain, and promote healing. We have provided you with several exercises that you can perform to help you with your pain or tightness you may be experiencing with your SI joint pain. If you continue to experience pain or problems in this area, then physical therapy may be your best option. Physical therapy is a very safe and effective way to treat this area of the body. Physical therapy consists of hands-on treatment to loosen muscles and joints, education on proper posture and movement to decrease pain, instruction on stretching and strengthening exercises to restore mobility and strength, and modalities such as electrical stimulation and ice to help the affected area heal. If the information and exercises provided on this website are not helping and you continue to have pain, please call our office for a free consultation. Our friendly staff will then quickly schedule you for a free consultation with no obligation on your part. It will be a time for one of our physical therapists to sit down with you and perform a brief evaluation to determine the exact source of your pain and what needs to be done to help you. They will try to provide you with some helpful information and tips and discuss what may be needed to further help you.